One thing healthcare needs more of is time with patients.
What makes someone feel truly cared for is being fully present.
It's more healing than people realize to just spend time listening to your patient with empathy. My job is to push them a little bit on this kindness front and draw out some of their insights and observations that they've had over their career. Combined, this group has over 100 hours of medical experience, so it's a pretty deep in terms of experience. But we have a nice distribution. Pardon me? Years. I'm sorry, what did I say? Hours, yeah. Katie put in 100 hours last week, but yeah, very good. And we have a nice distribution. I'm gonna have them introduce themselves, but first I want to just say a couple words about kindness in medicine. As an academic study, this was new to me, and I was delighted to find in the literature a lot of information on kindness or compassion. When you Google kindness in medicine and start to do the deep dive, compassion comes up a lot. And so for the purposes of this discussion, compassion and kindness will be used interchangeably. But in quick summary, compassionate care has been linked to faster healing, shorter hospital stays, reduced pain and anxiety. In addition, patients treated with kindness are more likely to trust physicians and more likely to follow treatment plans. Regarding healthcare providers, and this is really important in terms of the culture of the providers because they're the ones delivering the care, culture of kindness can reduce burnout and stress and promote resilience and teamwork. Compassionate leadership in healthcare setting has been shown to improve patient safety and quality of care. So it's not a stretch to say that these four panelists would all agree with me in that compassionate care and kindness in healthcare setting is a difference maker, both for patients as well as for healthcare providers alike. The challenge is how do we deliver compassionate care consistently in an ever-changing, time-pressured, progressively depersonalized, high-tech world of medicine? And that is the question that this esteemed panel will help us answer today. So I just want each of them to introduce themselves, tell you a little bit about themselves, their journey in medicine, and at the same time, I'm going to have them each answer the question, what does kindness in healthcare mean to you? Not in theory, but in daily work. So maybe Dr. Sandani can start.
Thank you for having us. I've known Patrick for a long time. We moved into his neighborhood 12 years ago, and so it's been a long time. So kindness in healthcare. So I'm a GYN oncologist. I was trained in obstetrics and gynecology, then did another 4 years of surgical oncology. So all I take care of in that field are women. Hands down, the kinder of the sexes. They're just amazing, they're compassionate, everything. And about 20% of my practice is breast surgery, and again, 95% of that, 99% of that is women. In oncology, there is no care without kindness, plain and simple. My old mentor, Jim Yor, told me one time, Mark Twain, the quote was attributed to Mark Twain, whether he did it or not or came up with it, is kindness is the language that the deaf can hear. It's also the language that the blind can see. So in oncology, it has to be felt. The minute you walk into our office, the minute you're in the operating room, the minute you talk to our front desk staff, to me, to our nurse, it just has to exist. If it doesn't exist in healthcare, if it doesn't exist in our field in oncology, then we're not doing our job.
Hi everyone, my name is Jess Topic. I am a registered nurse. I work at Golisano Children's Hospital. I have been in the pediatric emergency room for 10 years now, and I've learned a lot that kindness goes such a long way in some of the patient's most vulnerable moments. It's taking a moment to explain things, getting on their level. Giving a child a warm blanket sometimes can make a world of difference, and just taking a moment to explain things to the parents as well as to the child, it means the world. And sometimes you're with these people on their worst day, and we're running around doing 200 other things, and this parent, it's the worst day of their life, and taking a moment to recognize that, I think, is very important.
Good afternoon. I also want to thank you. I want to acknowledge that Pat had a moment of kindness when he invited me to this panel, so I want to be sure he gets recognized for that. I was a cardiac surgeon in practice in this community for 35 years. I began losing my eyesight. Turns out you can't do heart surgery by Braille. It was a shocking moment. So I had to pivot a little bit, and I became an executive coach. I learned about neuroplasticity and mindfulness and all the things that I had intuitively picked up over the course of my career. I graduated from medical school in the mid-'70s and went through general surgery and cardiac surgical training. And as you most probably can imagine, it was not kind training at that point. It has subsequently become better. They limited hours. I didn't have the benefit of that. But over my career, I recognized the difference that kindness and relationships made. Now, I didn't have a name for it, nor did I recognize statistically that it was an impactful thing. I encountered a patient with a problem called Takasabu's heart failure. And for any of you that may be in the medical field or know about it, it is a condition where somebody loses a loved one and subsequently within a short period of time has profound heart failure. And I mean severe heart failure with no other identifiable cause. And I was asked to see this lady who was approximately 62 years old. Her husband had recently died, and they had done a cardiac catheterization. There was no disease, no valve problems that they could identify, but her heart just wasn't beating. And we recognized that that's what this was, and she went on. Fortunately, she did not need a cardiac assist device. We were able to treat her medically, and slowly her heart did recover. But that impact of emotional distress manifesting itself in profound illness and profound cardiac dysfunction really awakened me to the connection between social and human relations and our own care, our own self. So it was really important to me to learn that, and I'm glad that I did. Now in my role as I'm a chief medical officer at one of the local hospitals, and my research for this program led me to a book called Compassionomics. I'd recommend it if any of you are interested. It's primarily about healthcare, but the reality is it transcends healthcare and talks about the economic benefit of care amongst people, no matter what the business. And you can be IBM, or you can be a health system, or you can be a mom and pop paint company. But the bottom line revenue is improved if your workers and your administrative leaders display kindness. So I found that fascinating, and not because of the revenue side of it, but because of everything else that goes with it. I am now a huge proponent of kindness in our hospital system. So I'll leave it at that.
My name is Dr. Katie Flaherty. I am currently in ophthalmology residency, so training to become an eye surgeon. I work mostly with adults, but I'm also we're training to be pediatric ophthalmology specialists as well, so I have a little bit of that pediatric ER experience. And I think, as I was thinking through the ways sort of on a daily basis I think about kindness or compassion in medicine, I think a lot of the ways that it manifests itself is through communicating clinical wisdom to patients, and by that I mean talking to patients about the truth and the accuracy of what's going on in their disease. I think there's a lot of time where kindness can be conflated with niceness, and I think that it's really important to be very truthful and very accurate as well, and that is kind at the end of the day. And so sitting with patients and talking through, showing them all the testing and talking through, what exactly you're doing and why is a very, I think, kind way to practice. And I had a patient yesterday afternoon. I was going through all their testing with them, and it took a little bit longer, but at the end of the patient visit, they were saying, wow, like I've been on these eye medications for this long, and no one's ever talked to us about why we needed them or why I had to keep increasing the amount. And so sitting with them and talking through, the findings that we're looking at, in the physician workroom, but really talking to the patient about that and explaining it all, and the decision making, I think, is really important for that communication and that clinical wisdom.
Okay. So we have some general questions for all the panelists and then some very specific ones. Since you can see it's a fairly wide distribution in terms of age and career path. But this next one goes for everybody, and it's really two related questions. Is kindness in healthcare just nice to have, or should it be considered a standard of care? And as a corollary to that, is it possible to deliver excellent care without kindness? We'll start with Sam again.
Oh, good. You can always start on that side sometimes. So it's lacking. It really is. It saddens me to say this, and we need the leaders like Dr. Hummel. We need the nurses like Jessica. We need the new upcoming physicians like Katie to bring it back, because it is lacking. I guarantee you everybody in here has been to see their nurse practitioner, their PA, their doctor, and you're shuffled in and out in 5 minutes. It's 100% lacking. So is it necessary? I mean, it seems like such an obvious answer. Of course it is. It's 100% necessary. But it's lacking constraints of time, constraints of finances, whatever you want to say. We're not delivering it as well as we really should. What was the second part of the question?
Well, can you deliver good care without kindness?
I don't understand how you can deliver any care without kindness. It just doesn't make sense. Short of being a radiologist or a pathologist who don't talk to patients very much, if at all, I just don't understand how it can be delivered without kindness. So it starts with kindness.
So we've all heard that, he or she is a really good surgeon, but they don't have a very good bedside manner. And you kind of give them a pass or her a pass because they're technically good, but you're kind of saying you don't agree that that's really
1,000%. They go hand in hand, because when Katie, when Dr. Hummel, and myself, when Jessica, we see a patient, we may be operating on them for 20 minutes, 2 hours. The longest surgery I ever did was 14 and a half hours. They don't remember any of that. In their worst times, all they're looking for is kindness. When they're asleep or they're in pain and things like that's when it counts. So I don't think they're mutually exclusive, or I should say they should not be mutually exclusive.
Okay. Jess, do you have anything to add to that? Or?
Yes, I completely agree with Dr. Sandati that a lot of the healthcare workers don't show the kindness that I think a lot of these patients, or all patients, deserve. And I don't think kindness is a very hard thing to do. It's just something that takes an extra few seconds. And even being in emergency medicine, I think that there's ways that you can multitask to show that you care about people, along with doing all of the medical things necessary, especially for the children. Most of the time the parents come in and they're more scared, but I often think that is fear underneath that, and they show anger toward you, but I think it's putting those emotions aside and not taking things personally, and treating the patient and recognizing this could be a family member, and treating all of those people as if they are your family member, I think is so very important. I think that patient outcomes are so much better when they feel truly cared for, and at the end of the day, that patient's not going to remember the medication that you prescribed them. They're going to remember the way that you made them feel.
Brian McLaren yesterday mentioned the sphere of kindness, and certain people have that, and Jess has that.
Thank you, Dr. Flaherty.
I know firsthand. I get emotional about this because she does work for us at our surgical center, but just people feel better when they're around her. I feel better when I'm around her because she just makes you feel good. And there's certain people in medicine that have that quality, and it just is a difference maker, And I don't know if it can be taught or if it's just innate, but it's so powerful. So anyway, thanks, Jess.
Thank you.
Brian.
I think it can be taught, and it doesn't have to be verbal to communicate kindness to somebody. In healthcare, just eye contact, leaning in, facial expression, a touch, all of that communicates caring and compassion. And so you don't have to be the most verbal of people. And the other thing that's important, I think, it's not the credential in medicine to be kind, but it's the people. And so my expectation of our health system is that the people that deliver the meals, the people that clean up the rooms, the aides, everybody is a part of that team. And patients and their families see more of those people, the ancillary help, than they do of the doctors. And so they actually have a bigger impact than the physicians do. So I strongly encourage all of our people, when I do orientation once a month with the new hires, first thing is I talk to them about is smiling. And if you smile and start your interaction with whoever it is you're meeting, you're going to change the whole dynamic of the interaction. And so I think that that's an important part of this. And to add on to it, I don't believe we can offer any sort of care, quality, otherwise, without an element of kindness in it. Does it have to be every minute? No, but it has to be a part of the interactions.
Katie, do you have anything to add to that? Okay. Katie, I'll go right to a specific question for you, and that is, do you feel the importance of kindness was emphasized enough throughout your training in medical school and now in residency?
Yeah, I think it's an interesting question, and I definitely think, kind of as was mentioned, we're moving towards having it taught more or maybe emphasized more. One of the things that was interesting in the panel earlier today was, like, it's funny we have to have a panel on this or a summit on kindness, and in some ways that reminds me of medical school, because there are some classes or some workshops, where it's like, okay, now we're all going to act and we're all going to be kind, and I think it's nice to provide things to be able to say, especially if it's a stressful situation or if it's an emotional situation and you're kind of overwhelmed and you need a little bit of a script to help start the conversation. But it is kind of a funny way to bring it in as, like, okay, we're learning about the GI system, and then now we're learning about, like, how to be kind to a patient. And I think, like, a lot of that should be, you should want to go into a field like this because you want to provide that kind of care. And I think in theory that is what happens. In practice, that there's a lot of material, there's a lot of stress, there's a lot of a lot of different things with life and the real world that make it more difficult to come back to that, like, true meaning of why you want to be in this field. But I do think that we're moving towards, in the education system and the medical school system, of teaching kindness. I think the best way, though, that I've experienced it is watching mentors and folks who are a few years ahead of me, watching them model that kindness and watching them deliver bad news to a patient, with a lot of compassion and kindness, or talk through situations or surgeries or various things that are difficult in a very kind way. And I think that's more educational than having a seminar on let's all practice. I'll be the patient, you be the doctor. Let's be kind to one another.
Okay, very good. So Brian, I wanted to ask a specific question of you, because you've had this career first as a cardiothoracic surgeon and now kind of switching hats, being now an administrator as the chief medical officer. How has your view of kindness in healthcare evolved? I know you touched on this earlier, but maybe you can elaborate a little bit on that.
Well, I think it has shown itself to be more and more a critical portion of achieving quality, as I was trying to say earlier. I just don't think healthcare, the way everybody in this room wants to be treated, can occur without an element of trust with your physician, and that trust comes from believing that he's got your best interests at heart, he or she, I don't mean to be sexist, and that, in fact, you are on the same level. One's not superior, you're both attacking whatever the illness, whatever the discussion is about, you're doing it as equals and partners in whatever this is. So I truly believe it's becoming more and more of a critical portion of healthcare. And the fact is, we now have a lot of scientific evidence that confirms that. You know, outcomes are better. As a cardiac surgeon, I can tell you that the data says that mortality or death following cardiac surgical operation is 26% higher in patients that don't have a significant other in their life, or somebody that they feel is important to. And I think that goes back to there's a quote from Viktor Frankl. I don't know if you know who Viktor Frankl was, but he stated, having survived the Holocaust and concentration camps, that having the why to live allows you to determine the how. So if you've got somebody that you want to live for, or that you feel is on your side, you're much more motivated to survive no matter what the consequences and no matter what the obstacles. So I really take that to heart. I think it's critical that we have compassion in medical care, and quite frankly, care of all sorts.
Great, that's great, Brian. Sam, I wanted to ask you specifically, yours is unique in that you're the one person that's in the field of oncology. So you often walk with patients through the most vulnerable times of their lives. How does kindness show up differently in that context?
Another tough question. Another tough one. So, as Patrick was saying, I'm a gerontoncologist, so unfortunately I deliver bad news. There are different stages of delivering news. If you close your eyes and you think about the first time you heard bad news, whether it's a diagnosis about yourself or someone else like that, if you went back and thought about it, how would you have liked that? No one wants bad news to be delivered, but how would you have liked to have been delivered? Do you want someone that just walks in and says, "Sorry, Mrs. Smith, you have cancer"? That just breaks my heart. Versus someone that walks in sits down, as Katie was saying, hold their hand, that touch, anything like that, and be gentle about it. That's the first facet for us in oncology, how to deliver bad news. And then as time goes along, there's a different level of kindness. It's more dynamic. It follows you throughout their path. It's very easy to be kind to strangers and not kind to people that you deal with on a day-to-day basis. It's very, very easy. Most of us are kinder to a stranger than we are to our husband, wife, kid, and things like that. So when you have this patient that you're following through, hopefully for 5, 10, 15 years, sometimes you forget to be kind, and you walk in, you're like, "Hey, Ms. Smith, how's it going? Good? Everything's good? Okay, all right, we'll see you in 3 months," and that's it. So you have to remember as you go through this journey with them to continue that kindness. And the last aspect is when things aren't going well. At that time, it's also important not only to be kind to the patient or whoever you're treating, but their family. Because no one loves them more in that room than their family. No one. Not me, not the nurses, not the chaplain, no one. And we forget to be kind to them also. Because a lot of times their frustration may come out as anger. "Why aren't you doing this? Why aren't you doing that?" That's also a time you have to remember to continue to be kind.
Good. So can kindness change the experience of suffering even when it cannot change the outcome?
100%. 100%. Mine's a very unique field because when women are suffering, they don't really care about themselves. They don't. Especially when it comes to the end of life. They're more worried about who's going to do the taxes, who's going to plan a vacation, who's going to take care of dinner. They are the superior human beings. Sorry, gentlemen. It's just a fact. And I promise you, I'm not trying to drum up business. I got, unfortunately, too much of it. Very unfortunate. But again, as the whole panel has said, continuing that kindness, even at that worst moment, it's good for the patient, it's good for the family. It obviously does not change the overall outcome, but for a better choice of words, it makes it a little bit more tolerable, a little bit more palatable, and they know they're not alone.
Good. So Jess, I have a question for you. As a pediatric ER nurse, you are dealing with both sick children as well as anxious parents. I imagine it is a big challenge balancing the needs for calm and compassionate communication to the parents and family while keeping the health and welfare of the child as a top priority. You and I have talked a lot about various ups and downs of the ER, but can you share with your thoughts on how you handle those dual roles?
Yes. So, as a pediatric ER nurse, I've learned that you are treating an entire room emotionally and not just the patient. As I said earlier, yes, the patient is of the utmost concern. However, at the same time, you do have a parent there that is scared, and it could be the worst day of their life. And I think taking that moment to help them understand what is going on, what the plan is, something as simple as telling them you did a really great job and you did an even better job by bringing them here today. Sometimes they just need to be told that they have done a good job, because I think every parent is so hard on themselves, and when their child is sick, it's the hardest day of their life for them. And so they're bringing them to the emergency room for a reason, because they've done all that they can, and now they need our help. And so I think it goes such a long way to explain procedures, to get down to their eye level, like Dr. Sandati said, and just explain things, let them know, update them. You haven't heard back from ultrasound in 2 hours. Go into the room and let them know, hey guys, it's going to be a little bit longer, but I'm here for you. And I think all of those little updates, those little things, bringing a warm blanket, a mom that's been in the emergency room for 8 hours and now it's 7 a.m., bring her a cup of coffee. Little things like that, I think, go such a long way. And just understanding, again, that a lot of this time, the anger that these parents show, it's really fear underneath, and not taking those things personally is, I think, one of the most important parts of our job. Don't take the emotions personally, because this is coming from a different place, and most likely a place of fear.
Great. Thanks, Jess. Awesome. What a great panel, huh? I do have a couple more, I think, really good questions for the panel, but we have about 10 minutes left in this session, so I want to see if there's questions from the audience, and there's one right there.
But sensitive to what the experience has been for the patient. I'm going to confess that when I need medical care, I go to New Jersey. I live in Florida. And so my question is regarding exactly that. What I have seen is happening to, I have a background as a medical doctor in Colombia, and I practiced medicine for 20-some years. And of course, it's very different here, because I had to work with public hospitals, which are not the same that they are here. They are really public hospitals. And my experience, I was a baby, I was 16 when I went to medical school, and my experience was that I found suffering. I was not prepared to find that. I was not prepared to respond to that. And I did get that from my school. But here, what is happening is we're moving into corporate. Yeah. And that's what I want to say. I want to know what's your experience dealing with corporate. The corporate medicine doesn't take into account compassion. In New Jersey, they do. I mean, it's in the walls, kindness, compassion for everywhere.
Brian or Sam or, I don't know, Katie, you go ahead, Brian.
I share your concern about corporate intervention in a lot of things, healthcare just being one of them. I think it's critical that people that are actually on the front lines have to pay attention to what they're there for. And that I'm talking about the nurses, the aides, the doctors, whoever it is, and not necessarily answer totally to the line of the corporate mentality. Now, if it's a good corporation, and I seem to think I work for one, but I think if they really are concerned about society and are, have those empathetic moments at the board level, they will respond appropriately and understand that the frontline people need the support to address the suffering. And I'd like to believe that we're headed in that direction. We have a long way to go. There's no question about it. But I do think that with these sorts of summits and educational efforts that are being made in the medical school and residencies now, that we are going to turn out providers that understand compassion, understand caring, and understand empathy, and try to display that in their interactions. So I'm hopeful.
Great.
Yeah, I think one thing I'll just add very quickly to that is being in an academic environment with many levels of trainees and physicians who have been there for a long time, you're really proximate to the various levels of experience and emotional hardening to suffering over time. And there was an interesting study that showed they measured empathy in providers over the course of a career. And by far, the folks with the most empathy were students who were in their very first month of medical school. And I see that all the time. You know, I'm in the middle of my residency, but we work with medical students from day one to the end, and it can be very clear who's an early medical student and who's, you know, trying to mimic the ways of the hospital later, where, you know, they're not as shocked maybe at some of the ways things are playing out. But I think that proximity to that empathy and the reason why is very important for all levels to just be around at, you know, every level of trainee, to continue to remind yourself and to be involved in the various training pathway.
Great. We have a question over here.
Yes.
Thank you for coming, and I have to thank you for your honesty. I'm a nurse, and I'm an old nurse who's been in the field 150 years. And I just started a business, which I'm crazy. But I'm going to tell you, the one thing that I'm seeing is disrespect. Disrespect from corporate to the doc. The doc who has to see somebody in 10 minutes and then get the heck out of the room because you're supposed to see so many that day. Nobody introduces themselves. They want to go ahead and the medical assistants, because God forbid we have RNs, do the taking the blood pressure, etc. They don't look at you in the eye. They touch your body without telling you what to do. And I think that's disrespectful of populations. We do have a little sensitivity to children. But I found as we get older, we lose that and think we should expect, I'm going to come in, do this, and then I'm the hell out of there. And then we wait for the doctor. We go to the ER. We sit there for 8 to 12 hours. Nobody comes in. We go out and we stand. And then if they admit you, where are you? In the hallway. Is that respect? And you're going to charge me ER prices. Now you think about that and where we are in healthcare. And honest to God, we're in trouble. And I want us not to minimize that as a team of people who care. And obviously you guys care. So thank you for that and let me spout a little.
I do have one more question for the panel, and we may be able to field one more question from the audience, but I want them to think about this. So I'm not gonna put Sam on the spot immediately. But the last question I was going to ask everybody is, if you could change one thing tomorrow to make healthcare more kind, what would it be? So that's the question you can mill on for a second. We have another question from the audience. Yes, sir.
Thanks. I would say to you, you do God's work. Thank you. And don't beat yourselves up too much. I'm very aware of amazing empathic stuff done by physicians and nurses at every level. My daughter this week has been in radiation therapy for her breast cancer. And they have a whole thing there at St. John's Hospital in the radiation department to do with chocolate. They wanted to know what kind of chocolate she liked. They didn't have it. When she went in 2 days later, they had gone and bought it, and the chocolate was prescribed. Also, I run a children's charity called Starlight. We give prescription pads, RX pads, to the medical staff in our 800 hospitals where we operate, and they say to the little girl, well, I'm prescribing you to take 2 new drugs, but I really think you need a puppy. And I'm prescribing a puppy. Sorry, Mum and Dad, but there's just got to be a puppy. Or I think you need to go to Disneyland. And I'm writing it down right here. I'm giving it to your parent. So I think actually you do, maybe I have a Pollyanna view. Maybe I'm seeing the best of the medical profession. But I think it's not as bad as you think. I think it's not all, careless.
Very good. Very good.
I just had a quick question because I am a human trafficking survivor and I develop content for trainings for professionals. Have any of you had any type of training around identifying the signs, any type of understanding of how someone may present with perceived mental challenges?
Yes, we do have, it's a very minor amount of training, but we do get some training on it in the emergency room. And it's more signs that the child will present with. And like you said, I think the biggest thing that they say is they're always going to come in with that person. And so it's sliding a piece of paper or doing something to ensure that that child is not going to be harmed for telling you what's happening. And a lot of the time, I unfortunately have experienced this many times in the pediatric emergency room. And just a month ago, we uncovered a child that was being trafficked. And it was because she had touched upon 7 different people, and she got to me, and I think she felt comfort in my care because I did go down to her level, and I looked straight at her, and I just said, if there's someone hurting you, you can tell me, and you're in a safe place. And she let the waterworks fall and just told me absolutely everything, and it was a completely different story than she had told the 4 people that she had spoken to before that. And so I think that's a huge part of our job, is knowing how to uncover those situations without putting the patient in harm at the same time.
I'm going to add very quickly to that I don't know if they still do it, but part of the requirements to maintain a Florida license, every few years you had to take a course in trafficking, recognition and management of human trafficking. So I don't know if that's still part of it.
Yeah, it is actually. Our recertification, we do have to take a course on trafficking about every 2 years, and that's relatively new, which is good. So this is the lightning round because we're over time, but if you could change one thing tomorrow to make healthcare more kind, what would it be? Let's start with Katie.
I'll be quick. I think we've touched on it. More time with patients, not feeling rushed.
Okay. Brad?
Reminders every day to everybody in the building what kindness looks like.
Mm-hmm. Jess?
I have to agree with Katie, more time with patients.
Mm-hmm.
Oh, man. I would have to go with access. Just access to physicians, nurse practitioners, PAs, access to the opportunity to be kind to. I'd have to go with access.
Right. Well, I want to thank our panel. These guys were amazing. And I want to thank FGCU. I forgot at the beginning to thank FGCU for hosting this amazing conference, which has been really impactful and wonderful. So thank you.
Thank you all so much. You can just leave them there. Thanks.